Earlier this month, the Washington State Legislature wrapped up its 2024 legislative session. And amongst the accomplishments of this year's session were several measures that help children and their families. During this legislative session, our state's lawmakers approved House Bill 1945, which streamlines access to the Early Childhood Education and Assistance Program, better known as ECAP. This ensures families that qualify for the Supplemental Nutrition Assistance Program, or SNAP, and other basic food assistance qualify for those automatically. The passage of House Bill 2124 that expands access to ECAP and early ECAP through Working Connections Childcare, a program that helps eligible families pay for childcare services. The allocation of $45 million to help schools cover free meals for qualifying students, and the allocation of $1.75 million to fund mental health consultants for early learning and child care providers to better support children with evidence-based response to behaviors and special needs. I spoke to Christina Coe, Director for Save the Children Action Network here in Washington State, and she had this to say about her organization's role in these developments and what still needs to be done.
I think one of the things I appreciate the most about my work is the opportunity to work with people, to work with families, to work with parents especially, that rely on these services, that have that lived experience, and putting them face to face with lawmakers that they can hear directly from them. It's also challenging on the provider side. I think because of how low the pay is for a lot of providers, it's very challenging to hold on to teachers and people that are taking care of our kids because they need to take care of their own families too. And it's hard to do that on the salaries that they're receiving, and that creates a lot of turnover. Also, the prices of early education and childcare for families is going through the roof. So the problem, there's different angles to look at it, but it's not great on either side. The nutrition is a big thing for Save the Children Action Network because we know that kids can't learn effectively if they're hungry, right? It's that basic hierarchy of needs that I think most of us have seen. And so for families that are already struggling, it's just compounding the challenges that these kids are facing, right? So they're coming into school, and if they're hungry, they're not able to learn effectively, which means they're falling behind with their peers. And it just feeds those cycles that we don't want to see kids facing. I think one of the things we talk about a lot with SCAN is the importance of that 0 to 3 time frame because of all those connections that are happening in the minds of young children. And early education is so important, but it's something that is often left out when we talk about education. That K through 12 is often the focus at state and federal levels. And so, as SCAN, knowing the importance of that 0 to 3 timeframe, we talk a lot about, hey, this needs more attention, this needs more investment, because kids need that foundation, especially kids that are already, their families are already struggling to access different resources. There is such a focus on, hey, we're seeing all these adults with mental health challenges or teens with mental health problems, and that's very important. It's something we should be talking about, but we can get ahead of it and we can prevent some of that if we really focus on mental health support and family support for infants and really young kids, because that's where it starts, is when those essential brain connections are being made in that 0 to 3 age range.